And thanks for tuning in to Safe Berks on BCTV. I want to start by thanking our sponsor, Visions Federal Credit Union. Thank you for your support. My name is Francine Scaboria, and I work at Safe Berks as the communications coordinator. Safe Berks provides safe haven and support to victims of domestic violence and sexual assault. Our advocacy and education programs increase awareness of oppression and promote the prevention of domestic violence and sexual assault. Our services are free, they're confidential, they're available 24 hours a day, 365 days a year. They're available in English, Spanish, or any other language needed. Our services include our safe house, counseling, legal services, medical advocacy, education and outreach, and our 24-hour hotline and text line. To reach our hotline, call 844-789-SAFE, which is 7233, or text the words Safe Berks to 20121. For counseling, call 610-373-1206, extension 606. For legal services, call the same number, 610-373-1206, extension 107. We are here to help. Today, we are going to focus on the impact of domestic violence and sexual violence on an individual's physical health. I'd like to start by introducing today's guests. Macy Lengel-Juberez, Director of the Medical Advocacy Partnership Program at Safe Berks, who focuses on serving survivors at Reading Hospital, Tower Health. We have Letty Vasquez, Medical Advocate at Safe Berks, who focuses on serving survivors at Penn State Health St. Joseph. And we have Myra Morales, Medical Advocate at Safe Berks, who focuses on serving survivors at Berks Community Health Center. Thank you, all three of you, for joining the show today and for everything you do every day to serve survivors. It's very appreciated.
Thank you.
So we'll dive in here, and our first question is for Macy. Macy, can you tell us about the MAPP department and also the two main goals of the MAPP department?
Yes. So the MAPP department, it stands for Medical Advocacy Partnership Program. And ultimately what it is Safe Berks creating and maintaining a relationship with healthcare centers all throughout Berks County. We have a special relationship where we have advocates on site at Penn State, St. Joe's, Reading Tower Health, and Berks Community Health Center. So we do have an advocate that can respond to those locations 24 hours a day, 7 days a week, 365 days a year. So, and with the MAPP department, we have two major goals. And the one is, probably the most common one, is what we call the rapid response, which is where we are responding directly to the hospital to assist with any victims of domestic violence, sexual assault, human trafficking. And what we do when we meet with them is do a little bit of options counseling. We provide support for them, and we help them make decisions and keep them safe for whatever decision they make post-hospital. The other part of the medical advocacy department is the education piece. So we work with doctors and physicians and translators in the hospital and anybody that would have patient contact, and we educate them on what domestic violence and sexual assault is, how to identify it, and what to do if they come across a patient that is disclosing domestic violence and sexual assault. Today, or from January 2019 to today, we've serviced over 500 victims in the hospital.
Wow.
And we have educated about 300 healthcare professionals.
That is amazing. That is some awesome numbers, and I'm so glad that all three of you are there for the survivors and to do that important education.
Mm-hmm.
So the next question is for Letty. Letty, can you talk about the benefits of having advocates in the healthcare centers and what kind of resources Safe Berks can offer victims in the healthcare setting?
Sure, Francine. So research is limited, but it's proven and it's consistent that when a medical advocate is present, the clients, the patients are treated less coldly in 69%. So they receive that treatment with respect. They're taken more seriously, especially if it's a sexual assault. 24 cases were more likely to be investigated further. 59% of the victims were more likely to have a police report taken. 82% of the victims that worked with a medical advocate received a forensic exam. Victims that work with medical advocates are more likely to seek community resources. So if not necessarily we have all the resources that they need, we can lead them in other directions in what they need. Something that we have to remember is that it's what the patient, this is around the patient. So trauma-informed care is on what the patient needs, what they want to receive. We have a lot of services, but if they don't want to receive the services, then, and they want other services that we don't provide, we gear them in that direction of what they want to receive. We can provide them support through sexual assault exams, the forensic exam. We can provide them support through police interviews, and also we can offer them and provide them the options, but they're gonna decide what they are going to use. We have a different amount of resources, but they're gonna decide which services are better for them, and they're gonna decide when they want to use these services. So we're just there to let them know, we're here, we're Safe Berks. This is what we, there's light at the end of the tunnel, and when you are ready, we're here for you and assist you the way that you want us to assist you. We also have the Victims Compensation Assistance Program through the legal department that they can assist to cover the charges for either counseling, for sexual assault exam, etc.
That's excellent. Thank you so much, Letty. So the next question is for Macy. Why is it crucial for emergency room physicians and nurses to be trained in identifying domestic violence and sexual assault?
So we know that approximately 80% of victims respond to the hospital after an incident of domestic violence or sexual assault. And we also know that of that 80%, only 1 out of 4 victims are actually ever being screened or being asked what happened. So they are, if physicians and nurses aren't asking, or they're not comfortable, or they're not able to identify the signs and symptoms of domestic violence, we are missing a great opportunity of intervention for the victims. It's in the hospital, we can typically get them away from their partners, we can meet with them, we can intervene, and it's just a really important piece if the hospital physicians and nurses know what they're looking for. We also know that in Berks County, out of the 500 victims we've serviced, probably about 85 to 90% of those victims were seen in the emergency departments in one of the hospitals. So that is the main place where we are actually being called to respond and assist victims.
Wow, those numbers are really powerful. So it's so important that the people in the emergency rooms know that you are just really a few moments away.
Yes, always.
Yeah, thank you. So the next question is for Myra. Myra, what other initiatives has the MAPP department assisted with?
Yeah, we increased the referral for counseling, legal department, and other resources that we have that, like Letty and Macy said before. Also, we are creating the universal screening tool for Berks County, and the real person Polycom PFA access that is for assist the victim to apply for an emergency PFA even when they are in the emergency room, so they don't have to go to the court. HIV follow-up care, and also we have a survivor bags, time they don't have clothes to wear when they are discharged from the hospital because they have to leave the clothes, so we have the survivor bag for them.
Thank you, Myra. The next question is for Letty. Letty, I understand that domestic violence has a serious impact on an individual's health. Can you tell us about some of the issues?
So violence has immediate effects on a person's health, which in some cases is fatal. Physical, mental, and behavioral health consequences can also be persistent long after the violence has stopped. Health consequences of violence can be immediate and acute, long-lasting, chronic, and/or fatal. So we can have physical, mental, behavioral, and sexual reproductive consequences. Some of the physical consequences are poor health status, long-term health problems, including bruises, abrasions, lacerations, punctures, burns and bites, fractured, broken bones or teeth, head injuries, eyes, ears, chest, abdomen, gastrointestinal conditions, and even death. Some mental issues or diagnosis can be depression, sleeping and eating disorders, stress and anxiety disorders, including PTSD, suicide attempts, poor self-esteem. Some sexual and reproductive consequences can be unintended and unwanted pregnancy, abortions, sexually transmitted infections, best known as STIs, miscarriages, and urinary tract infections. Behavioral consequences can be harmful, alcohol and substance abuse, multiple sexual partners, and even choosing abusive partners in later life.
Thank you, Letty. It's so important to get the information out there, as a lot of healthcare providers and the general public might not be aware that this trauma of domestic violence and sexual assault can cause so many other physical and mental and emotional issues over the course of a lifetime.
And sometimes we have patients or clients that they're going to the ED, they're going to the healthcare providers presenting these conditions, and they're like, but we already treated this, and they're like screaming help. But if the doctors aren't, the healthcare providers aren't screening, and they're not looking behind these health consequences, they're not seeing what how they can help these patients or clients. So that's why it's important to link these conditions, these consequences with the healthcare, so that let them know this is what you're looking for, not just something physically. It could be something mental. It could be something behavioral.
Exactly. Yes, thank you so much. And now the next question is for Myra. Myra, can you tell us some of the physical health impacts a person may experience after a sexual assault? I don't know if we should turn that. We are doing this show by Zoom, and of course we have our technical difficulties sometimes.
Yeah, so the impact is very similar to what Letty said.
Yeah.
There are immediate dangers similar to domestic violence, such as vaginal pain or vaginal bleeding that is not attributed to somebody's menstrual cycle. There also can be soreness, bruising, bleeding, difficulty walking, vaginal infections. So these are some of the things that we typically see immediately right after an assault. Some of the issues that are more long-term are maybe if they are undiagnosed right after the assault, is long-term HIV or STI issues. Also, mental health issues play a huge role in here. Some of the other physical things that we may not attribute to sexual assault is the chronic fatigue or pain, just constantly feeling down and tired. There's shortness of breath, muscle tension from being under the fight or flight mode where you're just kind of tense all the time, and involuntary shaking. So just constant, that's another from the stress. It's just another psychosomatic reaction to the sexual assault trauma.
Thank you. Thank you. And this is great information for everyone to keep aware of, that even if people in your life are experiencing these issues, that, you know, you may be able to have a conversation with them and see what the root causes might be, and then recommend them contact Safe Berks if they share with you that they have been abused. I want to ask Macy another question to you. What are some of the major issues that healthcare professionals should be aware of when dealing with domestic violence victims?
Yeah, so the three major health issues that I typically like to talk about when I talk to physicians and nurses and healthcare providers are strangulation, HIV, and traumatic brain injuries. And the reason I like to talk about each of these are because their symptoms are not always right after an assault. You don't typically see bruises or beating, like marks on your body from the strangulation, HIV, or TBIs right away. With the strangulation, you might see some marks around somebody's neck, but you don't see the fact that when they go home, and if you're not testing for it or you're not asking the victim, they go home and they can go to sleep and not wake up because you're not checking what's actually happened to the brain. And that's similar to traumatic brain injuries. It's often written off as somebody maybe using drugs or alcohol and acting oddly, maybe like slurring their speech, which again will be attributed to drug and alcohol issues. So it's something that often goes missed in the healthcare settings because they don't ask or don't think about how many times that victim's head has been possibly hit off a wall or hit off the ground or just even being punched in the face, and the amount of trauma that your head and your brain take when going through all of that. So those are some things that I really, really like to point out to healthcare physicians, because if we're not asking, a lot of times our patients aren't disclosing this. It's not something that they take serious, that they understand is so serious, and it's something that they're quite frankly embarrassed to admit.
Right.
So we need to kind of take the stigma away from that and just ask them and let them know that it's for their safety and for their health, and we just need to know it.
It's so important what you just said about the stigma, because part of the reason this screening is so crucial is because the person might not feel comfortable to volunteer this information.
Yeah.
So by being specifically asked in a professional way, in a confidential environment, that's breaking down that stigma that it's okay. In fact, it's not just okay, it's really important to ask for help when you're being hurt by someone.
Yeah.
So thank you for that. And I do have another question for Macy. We changed the order a little bit, but Macy, this is another really tough issue. Can you talk for a minute about how an abuser can use a woman's reproductive health as an abuse tactic?
Absolutely. So this is another issue that often goes unnoticed, similar to the strangulation, TBI, and HIV that I was just talking about. It doesn't typically leave bruises, so we're not paying attention to it. But some abusers will purposely hide their partner's birth control pills, will manipulate their birth control method, and purposely impregnate the woman if that is the case. And a lot of times when a woman discloses that they are pregnant, the abuser will take the option of follow-up treatment away. So if that woman wants to carry the child till full term, or if the person wants to get an abortion, a lot of times the abuser will force their opinion or their option on the victim and take their options or their choices away. So that's something that a lot of perpetrators do, and we don't think about it until we ask. We also know that 2 out of 3 adolescent females are forced into sexual assault through abusive relationships. So it's just something that we really need to, even with domestic violence, I know I am guilty of it. I don't always pair them together, but understanding how sexual coercion and sexual reproduction tactics can be used against our victims.
Yeah, I appreciate what you're talking about and sharing this information with the public and with medical providers, because I think for those of us who have had the luck of never being in an abusive relationship with an intimate partner, it's hard to even understand the level of cruelty that is involved with using a woman's own body against her. So this is something, if you're not educated about it, you might not know about it. You might not guess it. So this is really good information that you're providing in the training, so we can help people, we can help the victims and also help the healthcare providers identify, what questions to ask and how to screen for these issues. So thank you. So next question is for Letty. Another tough issue here we're bringing to light is, can you talk about how pregnancy often changes the dynamic of an abusive relationship?
Yeah, Francine, it's one of the most dangerous times in a relationship 40% of pregnant women who have been exposed to abuse report that their pregnancy was unintended, compared to 8% of non-abused women. Like you said, sometimes their body are used with these unintended pregnancies as a way of the abuser to manipulate the person with and reproductive coercion, etc. Pairing them together, like Macy said. Like sometimes we fail to pair them together. Homicide is the second leading cause of traumatic death for pregnant women in the US. 31% of maternal injury deaths, higher than preeclampsia and gestational diabetes. And in other settings as diverse as Bangladesh and India, intimate partner violence accounts for a substantial portion of deaths among pregnant women. So it's not just in the US, it's all over the world that we can see this. Women experiencing abuse in the year prior and or during pregnancy are 40 to 60% more likely than non-abused women to report high blood pressure, vaginal bleeding, severe nausea, urinary tract infections, hospitalizations during their pregnancy, and 37% are sometimes delivered prematurely. So that is how some effects that this pregnancy in an abusive relationship, how those health conditions can be affected.
Thank you, Letty. And again, thank you for all three of you for bringing light to this very tough subject. And a lot of people don't realize the risk that pregnant women are in from their intimate partners. And another resource, if people want to Google Finding Jen's Voice, is a really powerful documentary made by local filmmaker Tracy Schott, and it deals with this exact issue of abuse and murder of pregnant women by intimate partners. So thank you for bringing light to this and everything that you do. So next question is for Myra. We'll see, Myra, if the technology is working with us here. We're utilizing Zoom today. So Myra, can you talk about how children's physical health is also impacted by domestic violence and sexual assault? We'll give it a minute.
Yeah, children are very fragile, so we need to pay attention to them. They have similar health issues as not about. They suffer with immediate injuries such as bruising, broken bones, sprain. They also complain about belly pain, backache, headache, related to ongoing stress. Children, some children begin sexually acting out, begin to show signs of UTIs, STIs, if they are being sexually abused. Some other issues including wetting bed, acting out, crying or yelling, displays, mental health issues. They are very fragile, so children also be able to have access to the counseling that we offer in Safe Berks if the parent concerns to the counseling.
Yes. Thank you, Myra. And like you said, we are, in addition to serving adults, we provide a lot of services to children, including in our Safe House. Yes. A lot of children, hundreds of children every year stay in our Safe House with their mother or father, and also our counseling services, like you said, as well as our medical advocacy. So that's good to let people know that we're here for all ages. Yeah. Question for Letty. Letty, what is one simple way that healthcare providers can take a stand against domestic violence and sexual assault?
Well, Francine, one way that they can do it is by screening all their patients. If they screen all their patients, they're asking them the questions. The questions are on a universal screening tool that the Healthcare Advisory Committee worked on to have the same questions through Penn State St. Joe's, Reading Tower Health and Berks Community Health Center. There we have to still pilot them, but once we have them, it's the HITS tool. So they're going to visit different healthcare facilities, but they're going to be asked the same questions. So they're going to be familiar with these questions, and all they have to do is ask these questions. They're going to ask the questions directly, validate their responses, and evaluate and educate themselves, and then refer them to us. So once they use the screening tool. They add up the numbers. They call Safe Berks they call our hotline, 844-789-7233, and ask for a medical advocate. And then that's where they call us or to my other medical advocates, two other advocates that we have on call. And we respond to the hospital to provide support to these victims. We're Safe Berks, we're here. If they don't want to speak with us, just take them the information. And when they're ready, we leave them the information. It's now, we know it takes 6 to 7 times for a person to leave an abusive relationship. So it's not like, okay, they're gonna screen, they're gonna leave the relationship even if they're in danger. Sadly, it doesn't work like that. We wish it would work like that, but no. So we ask the healthcare providers, ask these questions. In the past, they were afraid to ask the questions because they were like, okay, so if we have a positive screening, what do I do with them? Well, now Safe Berks, we're there to tell them, we're Safe Berks and we're here. You ask the questions, you screen, and you call us, and we'll take it from there. And we provide them, these are the options, your services that we have that we can provide you with, and even community resources. And once again, the client, the patient, they're the ones that are going to decide what services they want to use, when they want to use them, and when they are ready to use them.
Yes, thank you so much, Letty. It's so important, this screening, to take place every appointment, everywhere, every time. Thank you. And a question for Myra. Myra, how does the MAPP department help healthcare providers understand domestic violence and sexual violence health issues?
Yes, we are providing ongoing training to the healthcare providers. Some of the training we offer are for domestic violence impact on children's, HIV and domestic violence and sexual violence, as well as domestic violence issues and dental care is very important. They offer a lot of refer for us. If you are interested in training, please reach out to the Medical Advocacy Department by calling 610-763-8110, extension 129. Again, reach out Medical Advocacy for training by 663-8110, extension 129.
Thank you so much, Myra. And I think we're getting close to the end of our show. So I want to just thank Macy, Letty, and Myra for all your work serving survivors of domestic violence and sexual assault every day, and for your work putting together this show. Thank you so much. You all have so much compassion and so much fierce ideals in changing things and making things better for survivors in our community and ending domestic violence and sexual assault. Thank you for everything you do. As we close up the show, we want to remind everyone Safe Berks is here to help 24 hours a day, 365 days a year. Again, our hotline is 844-789-SAFE, which is 7233, or text the words Safe Berks to 20121. Check out our website at www.safeberks.org for more information about our services and also information about how you can get involved and help Safe Berks if you want to help us continue our mission of serving survivors. We hope that you will save the date of Saturday, October 17th, 2020 for the Safe Berks Walk for No More. That is our rescheduled date for this event. We are proud to partner with the Reading Royals as we say together as a community, no more domestic violence, no more sexual assault. This is a fun and family-friendly event. It raises much-needed funds for Safe Berks. More info will be coming out, but for right now, just save the date, October 17th. And we also look forward at Safe Berks to participating in Art on the Avenue in West Reading. That will take place on August 22nd, 2020. We hope to see you there. So thanks for watching this show. Together, we can build a Safe Berks. Thank you.